See, this is how you know that things have gotten so far out of control that they don't know what else to do. So now they're angry at one another and they're pointing fingers at each other. And there's a lot of arguing and bickering in the White House and back and forth. It's like a pendulum that's swinging back and forth like a tennis court match. And it's just not working out. And so everybody's at each other's throats. And, a lot of people are paying for this, unfortunately, even with their lives. And it's really sad because we're hearing a lot of mixed messages about this virus. Like in the beginning, we were hearing mixed messages. We were hearing we didn't need to wear masks. Then we were told later to wear masks. Only the sick people were supposed to wear masks. And we were hearing that only the older people or people who had compromised immune systems or had previous health issues were more at risk. Now we're hearing a lot more information because everything was relatively new. And so now it's gotten into the point where it's progressed, it's all over the place. And they're arguing about whether kids should go to school, whether they shouldn't go to school, and it's dangerous. Um, I don't really think kids should go to school if this virus is the numbers are high in certain areas, neighborhoods, where people are more susceptible to catching the virus. And what we're hearing, what a lot of parents didn't know, is that children carry the virus in their noses and their throats. And so some schools had opened the first day and they found kids that were infected. Indiana was one. I think there were some other schools. And so a lot of people are worried. Even you have teachers that are afraid to go back because they know that even if it's not as severe as what some people was thinking and that kids might not be as severe, I think that's what they were assuming. So they're making assumptions, but most of those kids are not in a full day school 5 days a week sitting in classrooms. So you don't really know how this is going to play out. What you do know is kids do carry it and kids can die of it. Kids can get infected and they can transfer it, but they don't know how fast or what. What I know is a couple of weeks ago, I don't know if it was weeks or a couple of days. It might have been a couple of days. I had a video where it was a camp, and in camp, even though they stay overnight, they have children there. They have young people. And it took 10 days for 260 people to come down with COVID-19. And so just think of a school. They're inside a classroom 5 days a week and they're in instruction. It's possible that most of those kids will end up getting it, most of the staff will end up getting it, and everybody is not going to have a good outcome when they contract it. And so we know this is what is going to happen. It's going to be a disaster. So Trump is claiming that the virus is receding. So they're arguing in the White House right now. But one day after Birx, the doctor on his coronavirus task force, she says the pandemic is extraordinarily widespread, which it is. It is. It's everywhere. I know some people are so tired of it that they have, begun to break quarantine, so they begin to break the rules when they have a mandate or they close down their businesses because they feel drained because they're losing money, and there's a lot of uncertainty about the way this thing is going and the way it's playing out. And so you have a lot of arguing and bickering among the health officials, and the thing that bothers me is that all of these mixed messages have got a lot of people confused, and I believe that's the reason why so many people have died. Also, has contributed to it is because they don't have the correct information. And when you don't have the correct information, then you don't make up something that isn't happening. So President Donald Trump continued to push this rosy outlook on the future of the coronavirus crisis on Monday, claiming that the virus is receding. just a day after the prominent task force doctor warned that it's extraordinarily widespread as the U.S. enters the new phase of the pandemic, which is called the new phase of the pandemic. Doesn't sound good to me. So we are beginning to see evidence of significant progress, Trump. This is Trump. He said this on Monday evening in a press conference, even as the coronavirus cases increase in roughly 15 states and deaths have increased in 35 states. And so the virus is receding. This is Trump saying it. So his remarks focus on the states with declining positivity rates as opposed to the dozens of states and the coronavirus task force is monitoring for further outbreaks. So in hotspots across the South and the West, we've seen slow improvements from their recent weekly peaks. This is Trump continuing to make these statements. So as we begin to contain the virus, he claims they're containing the virus. I don't think they're containing the virus. I think it's running amok. And a lot of people are scared and they don't know what to do and where to work. And I've been hearing that a lot of people that have been trying to be essential workers or find work, when they contract the virus, the jobs fire them. They can't go back to work. So they back where they started when they wasn't working. They were scared to go to work because they were scared they contracted. Then they go out and get this job because they're afraid that they're going to get evicted or they're going to lose their funds. And then they end up contracting it and then they don't have any support. Then I heard some jobs don't even have PPE, I guess the gloves and the masks and the protective equipment. And so these lawmakers, some of them are not really in these neighborhoods. They don't live these lives. They're used to having money and they come from a different background and they live in different communities. And so they don't experience the same thing people that live paycheck to paycheck experience. It's obvious. So as we begin to contain the virus in the states, we must focus on the new flare-ups in the states where the case numbers have risen, including Georgia, Mississippi, Tennessee, Oklahoma, Missouri, and I think you'll find that they're soon going to be very much under control. Now, this is coming from Trump. Trump made a point to voice his resistance to the states reversing on their reopenings. So they just want to say this to try to smooth everybody over so they can just reopen stuff, and it's just going to be a major disaster because what's going to happen is the numbers are going to rise dramatically. You're going to have more deaths from this misinformation that we're being given. So Trump made a point to voice his resistance on this reversing of reopenings, despite some of the public health experts calling for areas of the country to enter hard lockdowns to stamp out this virus, the coronavirus. So lockdowns do not prevent infection in the future. Okay. So this must be coming from him. So they just don't. It comes back to many times. It comes back, he said. So this is Trump saying this. Lockdowns don't prevent the virus. Well, what they're trying to do by locking things down is they're trying to wait to see if maybe that they can get a hold on this virus and contain it so that it won't spread. They didn't say that it doesn't stop it, but it may contain it so that it won't spread, so enough people have time to get tested. If they do have it, they come down with it, they can go get checked out, and then that'll be less people that'll end up contracting it. Because if you just let things open up, then more people are spreading this virus around, and it's just going to continue. And it's going to continue to spread and evolve, and it may even morph into something worse. And that's what I've been hearing, there's other strains that could come out of this if it isn't contained or if it isn't handled correctly. And so far, it hasn't been handled correctly. So Trump urges Americans in the state where COVID-19 is a very low number, that's what he claims, and to remain vigilant to prevent the new virus hotspots. So I urge all Americans to continue socially distancing, washing hands, wearing masks when you cannot avoid crowded places. Now that was probably the only best advice that he gave out of this article that I'm looking at. But White House coronavirus response coordinator Dr. Deborah Birx came under fire from President Trump earlier on the day of her response to the criticism of the House Speaker Nancy Pelosi. So Pelosi was telling ABC News that this week that the co-anchor Martha Raddatz that the task force doctor has delivered misleading information to please the president. And so I even heard that Pelosi was not happy about or not trusting of Dr. Deborah Birx, was losing trust. That's what I heard referred to. So I think that the president has been spreading disinformation about the virus, and she is his appointee. So I don't have confidence. No, Speaker Pelosi has said. So she said she didn't have confidence when asked that if she was confident about Dr. Deborah Birx. So she said she didn't have that much confidence. And so though Trump has attacked several groups for their assessment of the coronavirus crisis, including governors, journalists, and health experts, such as the nation's top expert in infectious disease, Dr. Anthony Fauci, which they're taking that man through it. I mean, they act like he brought the virus in and he created it. And he spread it all around so people could get sick the way they're attacking him. And it's so mean. And it's like he's only doing his job. I mean, he's only saying as much as that he can say, and that's all that he can. They're all have let everybody know that this is a new virus that came in, and they're learning as they go along, and as they go along, and they get the numbers, the statistics from the hospitals and from the testing, and whatever the symptoms are from most of the hospitals and the patients that they get. That's how they learn more about the virus in the labs that are doing testing on it. People who actually have contracted it that are volunteering so that they could test what this thing is and how it reacts to people, and how they can combat it. They're learning as they go along. So he has made that clear, but he's being attacked on all sides. Deborah Birx, I believe she's being attacked as well in some ways, but I believe that a lot of people are upset because this thing is not controlled to where people feel confident anymore. And so that's where some of this attacks comes from, because people are tired. We haven't had a handle on this, and it's spreading, and we are hearing misinformation. So Pelosi is right in that sense. We're hearing a lot of misinformation, and it's just like the Spanish flu. They did the same thing. They gave a lot of people misinformation, and a lot of people died behind that because they weren't really getting the correct information. So it was the first time that he has fired off directly at Birx, saying that she took the bait and hit us. And so when Trump was asked about the tweet about Birx at his first dodge, he dodged the question at first and deflecting to how the other countries are dealing with the pandemic before saying he had a lot of respect for her. So I think we're doing very well. I told Deborah Birx, that I think we're doing very well. And she's at my office a little while ago. And she's a person that I have a lot of respect for. So I think Nancy Pelosi has treated her very badly, very, very badly, very nasty. So Trump said this and adding that the administration hasn't been given enough credit for the efforts on ventilators and testing. So President Trump says that he has a lot of respect for Deborah Birx, and so Speaker Pelosi treated her badly, and so basically in his tweets, and I probably believe that's in the video here. So he did not answer the follow-up question on whether he had agreed with Birx's current characterization of the outbreaks in the U.S., but he asked how he could act unilaterally at the coronavirus relief negotiations stall on Capitol Hill. And I believe the negotiations have to do with this bill that actually died in the Senate. And so this is about this bill that basically, if any of you guys are able, some weren't able to receive unemployment, but for those of you who are, you probably noticed that your unemployment check is a lot shorter, a lot thinner. not as fat. So um, that's because they were having a debate whether they should continue the $600 pandemic relief, and they wanted to scale it down to 100. So I believe they scaled it down to 100. Now they're talking about going up to 200. So they have not really come to a consensus, both the Democrats and the Republicans, on how they're going to release this next package. So they're still working on the kinks of all of this, and it's back and forth like a tennis ball game. And so they're bickering, they're debating, they're fussing around. People are agitated because this virus is not under control. We're hearing the mixed messages. We're hearing like this ray of optimism, and we'll see that in several articles because things aren't under control, and this virus is going to be with us for a while. And a lot of people are paying the price for it. And I'm hearing that some people that try to go out and do what Mitch McConnell was saying, people should not rely on the unemployment, $600 a week, or every so many weeks. They should go out and just get a job. So I'm hearing Mr. Mitch McConnell that people are going out and getting jobs, and they're essential jobs, and they wind up contracting it, and the jobs let them go because they cannot work on the job sick, and they cannot give this disease to other employees that haven't gotten COVID. So they can't even get their jobs back. Some people have ended up in the hospital behind this. So they're back to where they started. So what they are saying is that some of these jobs don't even give them hazard pay, and they can't even get these jobs back. Once they've been working there and they get sick and they contract it, they don't even trust them to come back. They don't feel comfortable because they've contracted it and they don't know if it's all the way gone yet. And then physically, they might not even be healthy enough to go back to work right away. They may be in the hospital for a couple of weeks, maybe a couple of months. And so what do you propose on those issues? And so these are the things that people, I don't think they really think about. And now we also got a lot of people that may end up losing their homes on top of this. And so this is the reason what's prompting people to go back to work, even if it's dangerous. And so a lot of people didn't want to go back to work because they're afraid they're going to get sick. And they were hoping that they could hold out that maybe a vaccine would come about before the end of the year, or maybe maybe it would come up with something, temporary. But none of that has taken place or transpired at this moment. And so now people are forced to make those hard decisions. Should they go back to work? What type of job could they do that's with less contact with people that you might assume may be infected, so that you won't bring it home to your family or become infected? And so these are the things that these people are not thinking about on Capitol Hill. Some of them are, and some of them aren't. They're far removed from the lives of people that are lower wage or maybe don't make as much money. And they don't understand that people live in families where they might even be a caregiver. They have people at home living with them, and it may be up to like maybe 3 or 4 or maybe more people living with them. And so if you get sick and you bring it home, you get tested, it may take a while to get your results. You're giving it to all your family members. And maybe one of your family members might have these underlying conditions, and they could end up dying because you made this decision. You're trying to keep a roof over their head. And these people that are in these suits and ties and dresses, pantsuits or whatever, they gotta realize that there are real lives at stake here. And I know you don't know anybody personally, but I'm saying this, that there are families that are dying, people that are losing their mothers, their fathers, their grandparents, their cousins, their sisters, their brothers, their children, they're worried about. And you have to look at it and step outside of yourself and look at it as if it was your family, that what if I lost my daughter? what if I lost my husband or my wife, or what if I lost my cousin or my niece? And so they don't think about that because it's not their family, it's not their life, it's not their decision to have to make those hard decisions to work in those conditions where it's more than likely that you can get this disease. And so I'm saying to you that people do need the extra money, not because they are having a party. It's because there's a lot of fear, there's a lot of uncertainty. People already know they have health issues. They might be the only income earner in their household, and they might be having health issues, but now this makes them more vulnerable to this disease. And so it goes on saying that this right here goes into the unilateral um, negotiation that stalled on Capitol Hill. So Trump said that he could stop the evictions through an executive order, and it could also take action on the collection of payroll taxes, something several outside advisors have advocated for. So I don't know if he's going to do that, but I will say this too. That's a double-edged sword because you have some people who are taking advantage of this pandemic, and they were in trouble with eviction way before the pandemic hit. And they become the ones that are the troublesome tenants. And they have caused a lot of problems with people who are in a situation that need the relief, or the they need rent relief, and they need help. And you have a couple of people that want to take advantage of that, and they kind of are making it hard for the ones that really need it. I've seen some really horrible stories about how people have lost their homes. Um, you know, that right there is sad. But I just wish that they could have weeded through all of this and said, okay, this person had an eviction already before the pandemic, and they've got a history of causing trouble with other tenants. So we're gonna put them in another category. Certain people, are making a lot of trouble for a lot of other people. And so, despite the deadlock on this deal, they claim Trump said that discussions are very good, but criticized the Democrats' efforts to secure the relief for the state and the local governments, which he has derided as a bailout for the Democrat-run states and the cities. And so the president continued to offer an optimistic timeline of coronavirus vaccine, claiming it may come far in advance of the end of the year, and urged Americans who have recovered from the coronavirus to donate their blood plasma, potentially rich in Covid-19 antibodies, to fight the virus in other patients. So ahead of the briefing, Trump signed an executive order aimed at expanding healthcare access in rural areas and increasing access to care through the telehealth. And so I think that's pretty much the article. But I thought I would mention this because I've done a lot of articles, or I've done a lot of videos about this virus thing. But I know people are tired, they're upset, they're worried, they're angry, they want to see this thing end. There seems like there's no end in sight, and a lot of people are disgusted by it. And I get it, I'm disgusted by it. Yeah, I wish it would go away, honestly. But I'm going to let this video go. So what are your thoughts on this? I'll tell you this. It's going to be with us for a while. I believe there's going to be more protests. There is going to be a rise in violence and frustration because people have more time to sit at home and think about some of the things that they haven't normally thought about. And so they know that this is affecting a lot of people that are marginalized disproportionately, black and brown people and poor people. And people who just don't have the funds, and it's forcing people to make hard decisions that could possibly put them in the hospital, or maybe worse, they can lose their life behind this pandemic. And so I ask you, lawmakers, to have heart, have more sensitivity or empathy for people who are not like you, that don't have a lot of money, and they may have like limited resources. Don't think that all people are doing the same thing, because not all people are doing the same thing. Not all people are just taking the money and buying TVs and going on vacation. Like, really, you can't go nowhere right now without getting sick. Um, so don't judge everybody the same way. But anyway, with this video, I'm gonna let it go. Um, you guys be safe. Keep your eyes open. Keep your family safe as much as possible, and stay informed. Thanks for listening.